All right. Good morning, Dr. Sheikh. Today is October 15th, 2020. Please confirm for the record that you are aware that this is being recorded and that you are giving your permission to do the interview.
Yes.
Would you please give your name in full?
Selim Wahhab Sheikh,
And what is your present title?
Assistant Professor at Clinical,
And where did you go to medical school?
William Carey University College of Osteopathic Medicine,
And where did you complete your residency?
The Ohio State University Wexner Medical Center,
And could you give the name of the current program you're associated with?
The Ohio State University Wexner Medical Center.
Okay. Could you speak a little about your current position and what you do on a daily basis?
Sure. I'm faculty in the Department of Family Medicine as well as in the Division of Integrated Medicine. I see patients at Ohio State Integrated Medicine where I mostly practice osteopathic manipulative medicine as well as some acupuncture. When I'm not doing procedures, I practice mind-body medicine and lifestyle medicine there as well. I see mostly referrals from various departments around the medical center and from external health entities, as well as intermittent self-referrals. One day a week is primary care outpatient family medicine at OSU Family Medicine at Upper Arlington. Half a day a week, I staff an OMM clinic or osteopathic manipulative medicine clinic at OSU Raritan Family Medicine, which is the core outpatient family medicine residency program. In that capacity, I serve as faculty for the family medicine residency program for the musculoskeletal rotation. On most days, I teach resident physicians and medical students who work with me in the clinics. I'm also faculty of the OSU Integrative Medicine Fellowship and work with the current fellow during their manual medicine rotations. Finally, I also physician medical student education for OSU Family Medicine at Upper Arlington. In that position, I coordinate the medical student experiences in my care practice throughout the year.
Wonderful. Thank you. Could you tell us a little bit more about the types of patients you treat in your program, who they are, and where they come from?
Yeah, the patient demographic for each different. For Ohio State Integrated Medicine, I would say probably the most diverse in terms of getting patients over Columbus as well as all over the state. There are some from out of state as well who drive like 2-3 hours to come see us. I think primarily that's just because there aren't many centers of integrated medicine in the area, as well as
Okay.
patients are limited by insurance. As far as the primary care sites for Upper Arlington Family Medicine, that demographic, though it's an affluent area, I still get a lot of patients from around Columbus, again, limited by insurance through CMS, Medicare, Medicaid. Far as Raritan Family Practice, that site is probably the least socioeconomically diverse in terms of getting a lot of patients with transportation issues, just in general difficult access. And so it's almost more of a service site in that respect.
Sure. Okay. Thank you. What are the unique challenges that you and your program face with COVID-19? What are some of the barriers and obstacles that you've had to come across?
So I would say the two primary ones, and one is unique to probably my practice in the sense that most of what I do at integrated medicine is hands-on. In I'm very up with the patients. There's always physical contact, and so because of that, in March, when things started to really close down, our clinic was the first within the medical center to shut down, just because we're always up close with patients. And
Sure.
so that was a big challenge just because it's hard to do what we do virtually, um, which I would say is the second
Right.
challenge in terms of adapting to telemedicine. Um, but as the physical aspect of the visit, that went to close to nothing for about 2 months. We did do
Oh my
some
gosh.
telemedicine from integrated medicine, but it's mostly with patients who I've seen before, so I could show them different techniques they can do on themselves through video. But it was very difficult
Sure.
to do patient visits that way. Um, as far as the telemedicine aspect, of businesses really capitalize on this new market and with all these different video platforms, and so there was a lot of speed bumps like in the road for OSU really selecting use. So that was kind of frustrating in going from one platform to another, and there are departmental
Sure.
changes, university changes. Um, but I don't to OSU, of course.
Sure. Sure. Okay. Um, how do you see COVID-19 impacting the learning of students in residence and family medicine? And do you think any of these changes will be permanent?
I think the biggest initially, at least for our medical center, and with the OSU College of Medicine, the decision was made to pull all learners and include for a lot of outpatient rotations, resident physicians as well, during, I would say, sort of the heat of the beginning of the pandemic. So probably from like March to May, even stretching to like June and July. Um, and so basically there was nothing in terms of actual in-person learning for these medical students, and also for a lot of residents. So in that aspect, it was difficult. Pretty much everything was self-directed in terms of reading and lectures, and trying to get as much quote clinical experience through not actually seeing patients. Um, so that was a big challenge. The other thing was, of course, I would say the physician side. It was difficult in adapting to virtual health or telemedicine, and there's also that hiccup for students as well, because once we brought them back into the clinic, of course, a lot of physician templates are filled with virtual health, and so we had to teach that way as well and have the students participate in that respect. I think as far as permanent
Sure.
changes, at least our department, and I think a lot of our peer departments are shooting for a goal of probably like 20 to 30% of telemedicine indefinitely. And so I think that's something that's going to be the for medical student education.
I see. What skills do family doctors need to fight this pandemic, and how do you think medical and residency programs are adapting to help their students and residents meet these demands?
So I actually think that family medicine physicians are probably the best equipped in terms of adapting to whatever healthcare needs there are. Situation like this, in a pandemic, just because obviously the further you are out from residency, depending on what you do in your you probably, I mean, there's a significant minority who are practicing full scope family medicine, but I believe residency in 2019, and so I still feel totally comfortable managing like prenatal care, inpatient medicine, emergency medicine, even critical care, for certain aspects. And in that respect, I feel like we could answer the call, to help out wherever is needed. And so to volunteer for our COVID-19 surge plan, and I was on call for a couple of months, basically just in case we had physicians get sick who normally do the inpatient medicine or emergency medicine, then I would get called up. Yeah. As far as the medical schools and residency programs adapting to help students and residents, I think there's been a revival in terms of wellness programming. That's good or bad. And by bad, I mean adding more required. It's not necessarily a good thing.
Yeah.
Um, and so I think that discussion has definitely come up, with especially a lot of the residents are were on the front lines in terms of caring for COVID-19 positive patients. And so a lot has been focused in terms of their mental health and just in general balance and well-being.
Makes sense. What have you learned through this pandemic overall?
I think it's sort of what I'd also previously said is in that family physicians are best equipped in handling a situation like this. When I was on call, I went through and did some continuing medical education in terms of like critical care, inpatient care, emergency, and I still felt fairly comfortable reviewing all those things that I did during my residency program. And so I think just with understanding that if things like this happen or when these things to brush up and just jump right back in.
What do you think your students and residents have learned through the pandemic?
I think specific and a lot of the students have been able to appreciate again the breadth of skill and practice, and also of course I mentioned that they're having to with telemedicine as well, and so I think the healthcare technology piece is boosted in terms of their education during medical school, and also I think sensitivity of a physical exam and balance tests in terms of laboratory tests and also imaging in a situation where you might not always be able to touch your patient.
That makes sense. If you could start this year over again and do things differently regarding COVID-19 care, what would you change?
I think with one respect specific to what I practice with osteopathic manipulative medicine, the needling practices in integrative medicine, I think that was largely ignored in terms of our medical center, and this isn't necessarily it's more so just the state of how these practices are viewed. It was basically just said this is not considered a necessary aspect of treatment or healthcare during a time like this, where I would argue that at least I have a lot of patients who ended up being hospitalized because they're in pain crises, where normally they're able to manage without much medication management because they get these manual therapies, but they weren't able to get that during this period of time, and so they ended up having to go to the emergency room for pain management and then end up being hospitalized, which, like, of course, exposes risk on both sides. So I think a better balance would have been beneficial for our patient population in that respect. There have been a lot of osteopathic physicians around the country who were able to treat COVID positive patients in the hospital at the peak of the pandemic, and achieved some good outcomes. And so I think that's something I know I would have been able to do anything differently about it just because of the red tape and bureaucracy of a large medical center. But if I could have garnered some support with some local colleague.
Sure. During the pandemic, what do you feel you've done right and why?
I think adapting to how to best serve patients during this time was a big piece of it, and I think the digital health. I mentioned that I was able to coach some patients through telemedicine in terms of treating themselves, and so I spent a decent amount of time coming up with material in terms of being able to share with patients digitally to be able to manage without me being able to treat them. And these are primarily for patients that I would see on a relatively regular basis in terms of managing their pain crises. And so I think in that respect, I feel that I can continue to use.
You mentioned earlier at one of the sites you see the demographics sounded like lower income and limited resources. In using technology, did you was that a barrier for certain populations, telemedicine, or did you not notice that as being an issue?
No, absolutely. That was definitely a barrier. And so one of the ways that our department has tried to mitigate is by setting up mobile units to go out to certain neighborhoods to basically have a clinic in a truck. And so one way that we've addressed it, I know of some local medical groups that are not OSU that came up with ways of, for example, they would send out some of their staff with like tablets to go to these patients' houses so that they're able to actually do a virtual visit with their physician. But for ideas and funding and my pay grade reasons, we weren't able to do that. And
Sure.
I think those are some ways that we've adapted.
Sure. Who are the people you have worked with most closely during this pandemic, and who impressed you during this time? And were these established professional relationships or new relationships?
I think for the most part, I work with a small number of people through the pandemic, at least in the early part. And that's just essentially who you have to work with in terms of clinic staff and your physician partners. And I feel like that's just a natural way that everyone has become isolated since we didn't nearly go into the office as much as we used to. In terms of work with individuals who impressed me, I think as far as our resident physicians, they were still able to learn and excel in what they did. Unfortunately, several of our residents did end up getting COVID. I don't think it was actually from patient care, but in that respect, they've still through that and with the support of the program and their colleagues have done really well. As far as new relationships, during the been placed on a couple work groups throughout the medical center. One is for a post COVID-19 surge population health recovery work group, in which I work with the leaders of the Ohio State University health plan and also medical center leaders in a move towards value-based care systems in the context of how the pandemic has affected our various patient populations. So working with those individuals has been a great learning experience for me, and it's exciting to basically lemons.
That's great. What is your sense of where family medicine is going in the future?
I think in a lot of ways, previously, the pandemic has renewed a spotlight on the family medicine and family physicians within the U.S. healthcare system. I think that a lot of and regional like government official note of what we can do, and even though we've always been able to do these things, that a lot of family physicians have really stepped up. So I think that definitely strengthens the profession moving forward. I would also hope that our leaders in organized medicine will use this platform to continue to work towards securing increases in graduate medical education funding to fill the growing need of primary care physicians, in particular, in order to ensure the highest quality of care for Americans.
Any views on important issues in the specialty related to COVID-19 that we have not addressed here that you would like to share with us?
No.
Are there any last thoughts you would like to add? This is your opportunity to share your thoughts with future generations listening to this recording, or to set the record straight on anything you feel might be important to address.
No, thank you.
Well, thank you so much. If you have nothing else to add, this will conclude our interview, and I'd like to thank you so much for taking the time to do this interview.
Yeah, definitely. My pleasure.
All right.